Canada is no longer considered measles-free. It's a classification it held for nearly 30 years. The Pan American Health Organization took away Canada's status for failing to prevent transmission of the virus, which began over a year ago. As of the end of October, Canada recorded more than 5,000 measles cases and 2 deaths. Most of those infections were in Alberta and Ontario. To explain how this happened and what it means for you, I'm joined this morning by Dr. Dale Kalina-Samji, infectious diseases specialist and chief medical information officer at Brant Community Healthcare System. Good morning.
Good morning. Good to see you.
At one point, Canada had more cases than the US and the UK this past year, countries that have much higher populations. How did we get here?
Yeah, we had 2 huge outbreaks, as you mentioned, in Ontario and in Alberta. And the context for that, remember as well, of course, Ontario is also much larger than Alberta is. So the number of cases that we had in Alberta per capita were actually enormous as well. And really what happened is those 2 outbreaks really drove the number of cases that we had, particularly because they were in communities where the vaccine rates are negligible. They're very, very low. And with measles, which already spreads like wildfire, when it is able to get into a community like that, it really can take over. And we can see the frankly absurd number of cases that we saw over the course of the past year. So really, it's disappointing to see that we've lost our elimination status, but it's not surprising.
Yeah, and you know, the numbers really tell the story here. So in the UK, I think their highest peak number of cases was just over 3,000. In Alberta, they had 2,000. In Ontario, they had 2,400. So just to paint the picture of how widespread transmission was just in the past 12 months. So where are the hotspots and why?
So in Ontario, the hotspots have been in a number of communities that are actually very close to where I work in Brantford, but extend out towards London. And in Alberta, they're quite diverse communities as well. But I think that the tie that holds a lot of these communities together is that they tend to be very tight-knit communities where exposure to the public health network can sometimes be limited, but also the way that we transmit information to one another in communities such as this can be very difficult. And at the end of the day, one trusts the people that you know and love more than strangers. And it's always difficult in tight-knit communities such as those to be able to transmit information and leads to stronger public health discord and an increased level of health literacy. And I think that that's what's led to really reduced rates of vaccines, particularly measles, mumps, and rubella, and has led to these outbreaks.
And it is the low vaccination rate that is cited as one of the reasons, hence for transmission, which is why we lost our status. Being more specific about hotspots, in March of this year, Ontario's Chief Medical Officer of Health said more than 90% of the outbreaks of the cases were linked to unvaccinated individuals. And in a memo, Dr. Kieran Moore said cases could spread in any unvaccinated community or population, but are disproportionately affecting some Mennonite, Amish, and other Anabaptist communities because of a combination of underimmunization and exposure to measles in certain areas. We know religious communities are rarely vaccinate, but they aren't the only ones choosing to withhold from vaccination. So to what degree is vaccine skepticism responsible for this outbreak we're seeing, not just in religious community, but social media and communities that are more integrated?
You're right. So this outbreak itself, particularly in Ontario, did primarily occur within some Mennonite communities. It isn't the religious component, of course. What it really is the structure of the community where there's a lot of reliance on speaking to others within the community for advice and only that. And that's what I was alluding to before, is that we get a variety of different biases from individuals who stay and within only one community. Survivorship bias is something that we think of and speak about often. You know, the commonly heard trope of, you know, my grandmother didn't get vaccinated against measles, and she's done just fine, so why should I? But at the end of the day, if somebody did not get vaccinated against measles and got measles and died, which is something that happens, they of course can't produce children. So you can't have that looking back to when that person had it. So it does propagate a lot of misinformation about how vaccines work and the role for them within the community. So we get a lot of that, and public health across Ontario, across the country itself, needs a lot of resources to be able to build programs for particular communities, whether it's in different languages, such as Low German for these Mennonite communities and other communities really across the country, which is what we saw in COVID, development of documents and programs in a variety of different languages, developing approaches that rely on community members to help with support, and really to build that level of trust, which is something that we don't see or see as lacking between doctors, between physicians, public health, and variety of communities. So it really has led to this low vaccine status, which has driven the measles outbreaks that we've had and the loss of our elimination status.
Given all of the areas that you've outlined, survivor bias, religious beliefs, lack of trust in the healthcare system, how do we get our status back? Countries that have lost this status have taken anywhere from 5 to 20 years to have it reinstated. Where does Canada sit? How do we get it back?
Well, we need stronger public health, and we need more funding for public health resources to actually be able to reverse this trend. We talk about very specific communities, particularly in Ontario, but if you look across the board, in particularly a lot of the prairie provinces, particularly Alberta, vaccine rates have been declining for a very long time, and that tends to be associated with low trust in the medical community, for example, but also, frankly, a lot of propaganda. And so to be able to counteract that, we need funding for our public health resources. We need funding for our healthcare system, particularly when you look at the fact that people with measles are being hospitalized. People with a variety of vaccine-preventable illnesses, COVID, RSV, the flu, are being hospitalized. So we don't have enough funding to deal with any of that. But realistically, funding to be able to support vaccine programs across the country are what's required to be able to reverse that trend and help us regain that elimination status, which will allow Canadians to be safer, will allow for people who are tourists to our country to be safer, and realistically to help protect those who can't get the vaccine as well. It makes everything safer for everybody, and we're just not there right now. And this is a very public bruise to reflect that.
Dr. Dale Kalinas, MG, thanks for your time this morning.
Thanks for having me.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.